COVID-19 had a dramatic impact on domestic violence victims and how we delivered services to them. When we shut the building in March in compliance with the governor's orders, that was not so unusual for domestic violence services. We provide these services 24/7 during weather events, during holidays. However, the status of our victims changed dramatically. They were quarantining at home with their abusers. They had less access to their normal supports and services. Our court system shut down. The filing of temporary restraining orders across the state basically fell off a cliff. There was increased stress and anxiety for victims who were calling us on our 24/7 hotline from closets, from cars, when their abuser went out. This was also an increased time of stress and anxiety and trauma for children who were at home to either be a victim of or witness family violence in a way they had not previously because they would have been in school or elsewhere. And so we pivoted with all of our programs, and with this program, we developed a HIPAA compliant platform so that we could do video counseling. Our hotline, of course, was very busy 24/7. Our shelter was available. We continue to do emergency response with the police. And we found through our data that while less victims came forward to us, given the circumstances, we had many more touch points and services provided during that period to our clients who were in crisis. So all of the various crisis services we provide were dramatically increased during the shutdown period. And then, of course, when we started reopening the building, all 6 business lines, including domestic abuse services, we reformatted the choreography here where services take place. We have welcome back victims for in-person counseling, for guidance from our civil legal clinic. And so the full array of services continues to be available now in sort of a hybrid of a live and virtual format. The court system is slowly reopening, and so TROs, those temporary restraining orders, are coming back up to more normal levels, and we are starting to see clients more and new clients come forward now who were really afraid to do so during the shutdown period. In phases, the YWCA reopened during the summer, beginning with aquatics on June 17th, and we welcomed back campers on June 29th and ran a 9-week summer camp for about 185 youth and preschoolers in the community, all with special precautions given the pandemic, special cleanings throughout the day, cohorting of groups, of course, face masks and social distancing. And we were really proud to report that we did not have any cases among our clients, our customers, or our staff here during the summer. We have pivoted again this fall to reopen our preschool, our after-school program, baseball, dolphins, swim lessons from babies to adults, our fitness center, and a variety of other programs, again, with constant cleaning and compliance with state guidelines. But I will share that, enrollment is down in a couple, not all, but a couple of our programs. And that revenue is critically important because a little bit of it does help to fund our free domestic violence services. All of those services, shelter, counseling, the hotline, civil legal services, all are 100% free. And we really are so appreciative of our donors to this Walk the Walk event to help us bridge the gap in this very, very unusual year. Our Walk the Walk against domestic violence is particularly important this year. In the beginning of October, we always kick off this special month, which is Domestic Violence Awareness and Prevention Month. Really on the steps of Town Hall this year, we are combining that with our Walk the Walk event and really creating awareness, increased awareness in the community about domestic violence. It is the #1 violent crime here in the community. It lives on every street here in Greenwich. It cuts across all socioeconomic and demographic dimensions here. It is also the second most nonviolent crime behind larceny. And so this is a widespread public health and criminal issue here in this community. And so we will spend the month raising awareness about this problem and all of the services we provide to victims, starting with little ones. We have a full-time child counselor, and we counsel all victims of all ages, all walks of life, whether they show up here, call our hotline, or are referred to us through the police. So coming out to join us on October 4th, you'll learn more about domestic violence and the services we provide. And we will be coming together in a socially distant fashion to walk together against this tremendous problem in our community and learn more about how we can make a difference and support victims in Greenwich.